right, October is Breast Cancer Awareness Month, and we're talking early detection. I'm here now with Dr. Yvonne Ottaviano, Chief of Medical Oncology and Director of Breast Oncology at MedStar Franklin Square Medical Center and MedStar Health Bel Air campus. You turned in your lab coat for a pink boa. It looks great on you.
This is not my regular office attire, but I'm wearing this in celebration of Breast Cancer Awareness Month. Not to bring attention to me, but bring attention to breast cancer.
That's why we're wearing our pink.
Exactly.
Doctor, I know we talk about this every year, but why is early detection so important in the treatment of breast cancer?
The earlier we detect breast cancers, the more likely we are to cure them. So before mammograms came along, women were waiting until they had symptoms, they could feel something, and at that point it was far more likely that the disease could be more advanced. Someone else is going to talk later about all the nitty-gritty about screening, but the most useful tool we have, and the oldest, is the screening mammography. And there's some advances in that in terms of using 3D mammography for women with particularly dense breasts. And also there's a breast ultrasound to be used not instead of a mammogram, but usually to work with a mammogram to highlight problem areas. And then there's also a breast MRI, which is way more expensive, but covered for women who have certain level of risk and who might have particularly have breast dents as well.
You know, I've heard from so many people that I've talked to about screenings, and they actually found it with a mammogram. Are there warning signs for breast cancer, things that you can look out for?
Yes, but you don't, hopefully you don't get to that point. But one of the major things is to feel a breast lump. And that's one of the reasons why I'm particularly a fan of self-breast exams, even though that's not been documented to really change things. But women can, if they do breast exams frequently enough, they get to know their own breast tissue, and if they notice a change, that's worth following and bringing to a doctor's attention. But some of the major things besides a lump, sometimes there can be changes in the shape of the breast, there can be some skin changes, there can be a nipple inversion, meaning that the nipple, instead of going out, can start to pull in. And then sometimes there can be just retractions or indentations elsewhere in the breast tissue. And then things like nipple discharges, they can be fairly common, but particularly if they're bloody or they're only on one side, and certainly in a woman who's not breastfed recently, that can be something to bring to a doctor's attention as well.
Once a month, correct? Those monthly, I mean the ones that you do
Once a month after your period, and we recommend getting a buddy to remind yourself.
Okay, all right. Love the boa.
Thank you.
Dr. Ottaviano, she's going to be next door taking your calls. Call to Breast Health. The number to call for your questions is 410-481-2222. We got the experts standing by waiting for your calls till 6:30.